According to an article written in 2020, they state that approximately 2 out of 3 Americans will experience some level of cognitive impairment at an average age of 70 years old. 2 out of 3, that's a lot. So, what are you doing today to preserve the function of your brain so that you can be the 1 out of 3 that doesn't become demented? Let's talk about one of the myriad of possible things that contributes to one experiencing cognitive decline, that being hypertension or high blood pressure. In this article, they state that hypertension is a risk factor for both vascular cognitive impairment and Alzheimer's disease, the two most common causes of dementia, which accounts for 85% of cases. They go on to discuss the clinical mechanisms of hypertension and why it would contribute to one experiencing cognitive decline. And just to sum it all up for you, they talk about how increased blood pressure can and will lead to the damage of the walls of your blood vessels. That increased pressure constantly beating against the inner lining of your blood vessels ends up making that vessel stiff and narrow, reducing the blood flow to the brain. Why this is important is because blood carries certain nutrients like oxygen, that your neurons need to survive. But now, if these vessels become more narrow and stiff, not as many red blood cells can make their way to the brain, which essentially just starves the brain of essential nutrients like oxygen. They also discuss how this can contribute to inflammation due to disruption of the blood brain barrier and impaired clearance of the debris or harmful proteins from within the brain. So think about it like this: you have all this gunk that's in the brain that should get cleared out, but now it can't, and it ends up staying in there, essentially just destroying your brain. Basically, what inflammation does is it slows down the conduction speed between neurons, meaning your neurons are now not communicating as quickly, and hopefully you can see how that would contribute to brain fog type symptoms or just slowed thinking or not being able to get the words out that you want to say, things like that. In this article, they state that a higher blood pressure is associated with a higher risk of cognitive decline, and that these findings highlight the need to induce early management of blood pressure. I think this is important emphasis, that being early management. Now, I know this is obviously easier said than done because most people do not take an active role or at least instill any preventative type measures when it comes to their health. They typically just wait until symptoms start appearing and then try to figure out what's wrong. But I think this is something that is so simple. Taking your own blood pressure, that is. Everyone should be able to do it. Monitor your own blood pressure and take your health into your own hands. I will tell you from personal experience, I'll never forget this. When I was in grad school, we were learning how to use a manual blood pressure cuff. And so, we're all walking around the class taking everyone's blood pressure. And I hope this gentleman has since changed his mind, but he blatantly told me that he would never check the blood pressure of any of his patients. He told me that checking someone's blood pressure was just one more thing that could be a liability and used against him if, let's say, a patient comes into his office, has high blood pressure, and then goes home and ends up stroking out. He'd rather just not know, not have that data, because if he never personally saw the data, he can't be held liable. As they say, ignorance is bliss, right? This is the unfortunate reality of the healthcare system today. So I encourage you to educate yourself and always be willing to ask questions. To wrap this up, high blood pressure is a major risk factor for cognitive decline and dementia. Be sure to keep an eye on your blood pressure and keep it under control through lifestyle changes like exercise and a healthy diet and stress management in order to reduce your risk of developing cognitive impairment later in life. If you do have hypertension, don't let your doctor just brush it off. It is essential that you work with a qualified healthcare provider to develop a treatment plan to manage your blood pressure and ultimately protect your brain health. And also, keep in mind that within this video, we talked about just one of the potential factors that can contribute to you experiencing cognitive decline. But of course, just like every chronic illness, there is a web of potential factors at play, and they may not all apply to you, meaning maybe you don't have hypertension, but you do have cognitive decline. If that sounds like you, I've created a free PDF guide that you can download on our website where I discuss all the factors at play when it comes to cognitive decline and ultimately things that we can do to manage each step along the way. I'll leave the link below.